This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted that you're with us today. You know, Thomas, all during the pandemic, everyone we talked to, no matter what their medical specialty, said exercise was important, and if nothing else, people should get out and walk. You remember that?
Not only that, but we've talked about doing this very segment since then.
So let's learn about how we should properly walk. We are delighted that we've got Dr. Dalerie Wilkerson with us today. She's a podiatrist at Parkland Health and Hospital System. Dr. Wilkerson, welcome to the show.
Thank you so much for having me.
You know, I know this sounds crazy, but I want our listeners to hear this answer from a professional like you. Is there a proper way to walk?
Absolutely. First thing you should do is just to stay upright. Don't hunch over. Lengthen your back. Look straight ahead while you're walking. Swing your arms and step from heel to toe. And also just stay engaged at which way you're walking. Put the cell phone away. Don't look down at the screen and just walk straight ahead.
You know, that's great advice, and I'm glad you said put the cell phone away. I see so many people walking and texting. I saw some people the other day, they almost walked into oncoming traffic because they were texting. It's very dangerous.
Very dangerous, yes.
Now, I know you talked about the right ways to walk. Are there any that just really get you that are the wrong things to do that could cause injury or harm?
Walking in shoes that are too large, that could cause tripping or stumbling. I see a lot of people decide to get larger shoes because they think it's a better fit. Well, it really isn't. It will cause you to stumble. And also walking in shoes that are too tight because you're crunching your toes up in the shoes, and it may cause pain, and then you may stumble also. So those are the two things I really don't like to see.
I would say as a podiatrist, you treat a lot of injuries.
Yes.
But what are some of the common injuries you see as a result of walking?
Blisters, heel pain, ankle sprains, ankle strains, stress fractures. Those are the common things that I see because I call them the weekend walkers who want to get out and lose some weight. And they start out too soon. So you don't want to go out and try to walk 2 or 3 miles. You want to start out maybe for about 20 minutes or 30 minutes because your shoes may not be correct. The shoes that you're wearing may not be the right ones, and you want to go out there and walk for an hour, and you come back and you have blisters and you're painting, and then you have to come and see me. So it's okay. It keeps me in business, but I really don't recommend going out immediately and just trying to get out there and be a weekend warrior.
You know, that's great advice. And, you know, when you do go out and walk 20 or 30 minutes, or even if you're out in your yard doing work, sometimes, you know, your feet get tired. That's kind of normal. But if someone has serious foot pain, what do you recommend they do?
Okay, so when you first come into the house and if you're in pain, I say sit down, elevate your feet, take your shoes off, and check your feet for sore spots. And then you want to start soaking your feet after that in some warm water and Epsom salt or warm water and vinegar for maybe 15 or 20 minutes. You can massage your feet, stretch your feet, apply some ice. And there are some topical solutions that you can apply for pain relief. First of all, you want to check the ingredients and make sure you're not allergic to them, such as BioFreeze, and there's something called Zim's Max Freeze. You can get these things at Walmart and apply that topical to your feet. And if anything happens, such as the pain won't go away after a few days, or if you have an open wound or you're unable to stand or walk, you can see your local podiatrist.
I'm going to ask you a few questions combined into one, if you'll allow me.
Sure.
What, in your opinion, is the best footwear for first, walking, second, jogging or running, and even third, hiking on trails?
Wonderful. The first foot, say for instance for walking, you want a lightweight shoe with support and cushioning. You want something breathable so that to keep your feet dry. And of course, some shoes for shock absorption. And something that's comfortable. For example, Asics and New Balance and Brooks, those are wonderful shoes for just walking. And also, for any shoe that you get for walking, running, or hiking, you want to purchase the shoes in the evening because the feet are at their largest, and your feet expand throughout the day. So that's when you want to get your shoes sized. For jogging, you also want a shoe with good support and cushioning that provides impact, because you're running and your feet are hitting the surface. So you want to get something with a little bit more absorption and cushioning. Asics are good too. New Balance and Rite and Hugo shoes are wonderful shoes. And finally, for hiking on trails, you want something that's durable and lightweight and protection, because you're going to be walking on kind of uneven terrain. And you want something waterproof that'll protect your feet from any little varmints that are crawling around or that may bite you. So I prefer a shoe that comes up for a hiking boot. Those are great, but as long as they're lighter, because if you need to run, you want something light but yet durable.
You know, those are great answers and really gives us something to think about. I had no idea that my foot was bigger in the evening. I'm glad you told me that.
Yeah.
Now let's pivot just a bit. We're not going to go far from the shoe. What kind of socks do you recommend?
Well, you want something that is lightly padded in the key areas, such as the heel or the forefoot. So you don't want to purchase a sock that's too thin, because the foot will move around in the shoe and that'll cause blisters. You don't want something that's too thick, because the sock will cause tightening and cramping, in your foot. It bunches up in the shoe. So you want a sock that is moisture wicking. It pulls the moisture away from the foot and decreases the friction, such as a cotton sock or wool blend, and that's your personal preference. So, just look around at the store and see what you like and what's affordable.
You know, some people that I know enjoy walking, and their physicians want them to walk, are patients that have diabetes. But sometimes these individuals may have nerve damage in their feet or lower extremities. Do you have advice on people with diabetes on extra prevention or precautions they should take to prevent injuries to their feet?
Absolutely. I highly suggest a shoe with soft fabric interior, something that's padded with foam that eliminates friction, something that offers comfort and protects the feet, and a stretchable mesh shoe at the top, and that conforms to the foot. And that will decrease the pressure points, because anybody with neuropathy really doesn't need anything pushing on their foot causing pressure points, because they really can't feel. So extra wide toe box and extra depth cushioning is perfect for a patient with neuropathy. And patients with neuropathy can go out and walk. And that's actually really good for a person with neuropathy, the walking is.
This is Dr. Dalerie Wilkerson. She's a podiatrist at Parkland Health and Hospital System with some great tips on walking, with more to come after this quick break on the human side of healthcare.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back, and thanks for joining us. We're continuing our conversation with Dr. Dalerie Wilkerson. She's a podiatrist at Parkland Health and Hospital System. And if you take a lot of steps, chances are your feet feel it. Well, we're going to ask her for more tips on how we can walk better. And to start this segment off, what about people with various issues with their feet? Bunions, blisters, hammer toe. What about those? Can we still walk safely?
Absolutely. You just want to get a shoe that is soft. Say, for instance, if you have a bunion, you want to get a soft fabric shoe on the interior, so that the foot can conform to that shoe. And that way you can continue to walk. If you have hammer toes, you want to get a shoe that has a higher toe box, so that the hammer toes won't rub against the shoe as much and cause any friction. So we want you to get out there and walk. Go to the store in the evening, allow someone to fit you for the shoes. Don't just, I have a lot of patients who their sons or daughters want to buy their mom some shoes and they think these are perfect, and then the patients come in and they come here and the shoes are terrible. So I said, well, who bought those shoes? Well, my son did, but I didn't go try them on. So you have to try on the shoes. And again, try them on in the evening. And that will help so much, and I hope that everybody will take this advice and get out there and walk.
You know, that's such good advice, and it just dovetails nicely with what all the other medical experts have said, especially in the last 14 months. For people that do experience foot pain, even when they followed all the good points and advice you've given, are there any orthopedic products or other devices that can help people so they can walk even if they experience foot pain?
Absolutely. There is, and I'm not putting out a press point for these people. The Good Feet store, they have wonderful insoles, and they measure your feet for the insoles, which are excellent. There's ProFit insoles and Dr. Scholl's insoles that you can purchase over the counter from Walmart or Target or places like that. But the best thing that you can do is to wear a supportive shoe, make sure you stretch, and get an insole from over the counter, or you can visit your local podiatrist and they can measure your feet for some insoles also.
So let me ask you this question. For your patients, especially ones that do have foot pain, do you recommend they walk on as flat a surface as possible, or is it okay if they go up and down hills? Does the terrain come into play?
Yes, it does. For my patients, I prefer, if possible, if they can go find a track at the local school. That's perfect because it gives you a little bit more cushioning. And if that's not possible, if you have to walk on the streets, make sure that it is a flat surface. If there are some hills, make sure that they're not too hilly. But my preference would be the track first and then just a flat surface second.
You know, you've covered a lot of excellent points related to walking, foot care, the type of shoes, the type of socks. We have a wide variety of listeners listening to this show. Do you have other tips or comments on walking safely?
Okay. Well, just foot care in general. Make sure you wash your feet every day and exfoliate your feet. You can do that, excuse me, just like you wash your hands. You're going to wash your feet too, dry them well, moisturize your feet, and make sure you wear a shoe with some support. And again, I can't stress, go have your feet measured, go to the store. You can go to places like New Balance and get your feet measured and purchase your shoes in the evening. And if you have pain in your feet, sit down, stop walking, go figure out what's going on, if it's the shoe gear, if you've just been walking too much, and just sit down and figure it out. And number two, and finally, please check your feet after you finish walking. Take off your shoes, make sure there's nothing in your shoes, look at your feet, make sure you don't have any red spots at the bottom of your feet, and those spots could lead to blisters, which can cause ulcers. So walk, do whatever you need to do, but make sure you take care of your feet.
Dr. Wilkerson, I would like to talk about the arch for a minute because I remember when my mom took me to a real shoe store back in the 1940s. They always said fit to your arch, and I particularly had a long arch and a high arch. So can you tell us how we need to be thinking about, I think everybody tries a shoe on and they mash to find their toes, but that's not always right, correct?
That is correct. It would help if you get the shoes, you get whatever shoes you like. It's the insole that makes the difference. So you would probably have to go get some other insoles. If you have a high arch, you would need an insole. So you take out the you take out the insoles from the shoes that you purchase, and you need to purchase some insoles for high arches. Or if you have flat feet, you need to purchase insoles for the flat feet. And again, places like the Good Feet store, you can go in with the shoes and they will suggest which of the insoles to purchase. So it's really difficult to find that one pair of shoes that is going to fit you correctly. if you have high arches or low arches. So you're going to have to get some insoles.
Now, I walk a lot. I mean, a lot. So how do I know when I have worn that insole out and the shoe itself?
I often recommend that patients change shoes, and it depends on how much you walk. So you say you walk a lot. You may need to change shoes or insoles every 8 to 12 months. The average person should change shoes maybe every year. But however, there are some patients that have several different shoes, so you shouldn't wear the same shoes every day. Honestly, I have maybe 6 or 7 different pairs of tennis shoes. I can wear a different pair of tennis shoes every day, so my shoes won't wear out as fast as somebody who wears the same pair of shoes every day. So again, to answer that question, about every 8 to 12 months. And if you look under the bottom of your shoe and you see it's wearing, you may want to change it even more often, maybe every 4 months.
And we're talking about walking specifically in the context of kind of tennis shoes and outdoor activities. But I know for the ladies, heels can present, I guess, both a problem and an opportunity, right?
That is correct. We have to wear our heels. We have to look cute. I understand that. And it depends on the height of the heel. 2-inch heel, okay. 3-inch, you're getting into a little shaky territory. 4-inch is just too high. So I would highly suggest wearing a shoe with a wedge. And the ladies know what I'm talking about. You have the wedge heels, and you can have a 2-inch wedge heel where the toes and the heels are about the same, 2 inches all the way across. That's actually safer than wearing, say, for instance, a spiked heel, because the spiked heel is going to put a lot of pressure on your forefoot, and you could end up with a stress fracture, or you just have what's called metatarsalgia, where the bottom of your toes just start hurting. And that's because you're putting too much pressure. One other option for the high heel shoes, they do have insoles for high heel shoes. So you may want to go get some high heel shoe insoles to fit in there if you just have to wear those 3 to 4 or 5-inch high heels.
What about the clogs? I know a lot of our healthcare friends listening might use Danskos or the like. Merrell's, that's another brand. And then just the regular old clogs now, I think, became its own brand. What do you think of those? Good support or no?
It depends. The Danskos have good support. I have worn those before. However, with the clogs, your feet have a tendency to shift forward and your toes hit the top of the clog, and that could cause a lot of pain. I see a lot of patients that come in and say, my toes are sore on the end. That's because it has nothing to hold back. You have the clogs, and they're just jamming into the tips of the clog. So if it's a personal preference, as long as it has support, but I highly suggest a tennis shoe, an athletic shoe.
And we had asked this, as Steve mentioned at the very beginning, but I'd love to get your take on it from somebody who takes care of our feet. What is the value of walking?
Walking is the safest and the easiest form of exercise. I love walking. I walk myself and I run. And it will help in everything. It helps to reduce the neuropathy. It helps circulation. So I highly recommend walking, but you have to get good pair of supportive shoes with some type of an insole, with some type of cushioning. Take care of yourself. Come home, check your feet. Make sure that you stretch also. I'm sorry, I forgot to put that in. And if you're going to walk correctly, stand upright, put the cell phone down, eyes forward, walk at an easy pace for like the first 3 to 4 minutes, then that'll warm you up, and then you can do your brisk walk for the next 20 to 25 minutes and cool down. So all of these things are really important. You need the walking to exercise, and you have to take care of yourself. You got to be healthy.
Dr. Dalerie Wilkerson, absolutely we do, and thank you for giving us some great tips on how we can when we are out on the walking and hiking trails. She is from Parkland Health and Hospital System, by the way, and you can catch all of our interviews on our podcast, The Human Side of Healthcare, on all the major podcast players. When we come back, we're going to talk about our kids, particularly to a problem that you may not know the extent of, but it is huge. We're going to talk to Stacie Bukowsky. She's the Director of Pharmacy at Scottish Rite for Children to find out some of the programs they are doing to address it. That's next on The Human Side of Healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
And welcome to the human side of healthcare. We're delighted you're with us today. Today we want to talk a little bit about pharmacy advice, drug interactions, opioids, those types of things. And it's a patient safety issue. It really is. We're delighted that we've got with us Stacie Bukowsky, who's the Director of Pharmacy at Scottish Rite for Children. Stacie, welcome to the show.
Thank you very much. I'm glad to be here.
You know, Stacie, we hear a lot about pharmaceuticals. We hear a lot about drugs. We know hospitals especially are trying to reduce the use of opioids. They're doing everything they can to keep patients as comfortable as possible, but trying to do so by reducing opioids. What are some of the national trends, statistics, and your opinion as to the need for this patient safety initiative?
Well, one of the things that we see here at Scottish Rite, being we are a pediatric orthopedic hospital, is that most, if not all, of our patients do go home on pain medications following an orthopedic procedure. And nationally, we see that orthopedists are the fourth leading prescriber of opioids in the United States. And, just historically, there's just been a steady increase in the abuse of prescription narcotic medications that are contributing to the opioid crisis that we hear about. And I think initially most people, when you hear of the opioid crisis, you think of, the illicit side of medications. The prescription medications really are playing into that. And so in response to the national efforts to reduce those and reduce the opioid prescribing, Scottish Rite really sought out to systemically lower that prescribing and identifying a surgical population that was homogeneous that we could work with and identify. One of the groups that we did look at in doing that was our scoliosis patient population. And in looking just kind of at the big picture, what we saw is that about 30% of the patients that are prescribed opioids for chronic pain do misuse them. And this is not just our patient population, this is, across the board. And there's a huge economic burden for prescription opioid overdose. I mean, you see overdose, you see abuse, you see dependence. And financially in the United States, that's estimated at over $78 billion. So it really does impact us all when you look at that across the board.
To keep the children and patients that you treat as pain-free as possible, especially as you indicated after orthopedic surgery, what are some of the things that you can do where you help relieve the pain, but you don't use opioids?
Our biggest patient population that we see for orthopedic surgery tends to be older teenagers. So we see more of a 12 to 17-year-old patient group. And in those, nearly 4% of those report misusing opioids in the last year. So when you're talking about sending that group home with prescription medications, that's our patient population, and we're really looking at lowering those. 70% of teens also report mixing prescription opioids with other substances. So that's yet again another reason that we want to minimize what we're sending home with them. And then they also tend to co-ingest, if you will, or take in addition to those prescription opioids, they're 8 times more likely to use them with marijuana and also with alcohol. So really we've done a number of things to work with our families and our patients and our medical staff, really how to taper those off and to teach the families how to reduce those over time and then educate on what to do with those when they do taper off of them.
Stacie, I think education is so important. As a layperson, let me explain why I say that. we give people antibiotics and say, here's 2 weeks of antibiotics. If you feel good at the end of week 1, don't quit taking them. Take the full round of antibiotics. Opioids is just the opposite. But to hear you go through kind of weaning, for lack of a better term, off of that, it kind of reminds me of steroids, where you have to wean yourself down steroids.
It is. It's very similar. Very similar. And you want to wean off so that at the end of, and it depends on the case type, but we've got a 10-day and we now have a 5-day taper or a wean. But our initial study that we did in 2018 and then in 2019, so what we found in the initial was we had anywhere from 15 doses to 100 doses going on with kids. I mean, it was just all over the place. So we started with 45 doses. We said we're going to send 45 doses, and we did studies, and we followed up with families and said, what was your pain level? How many days did you need, how many days did your child need to have, take the medication? And initially we found, that they were taking it for a longer period of time. So this really gave them an opportunity and an understanding of how to taper off and then transition to the ibuprofen. So it was very helpful. And then we also, of course, got feedback from them. So we did 2 complete cycles of 45, and then we found out that they really weren't needing that much. And so then we cut back to 40 doses, and that's where we still are at this point.
You bring up some really good points. Thomas and I interviewed a board-certified child and adolescent psychiatrist the other day, and attempted suicides are really increasing. And I know we're talking to you about orthopedics, but she indicated that even over-the-counter medications, they're seeing teenagers abuse, where they take tremendous amounts of Benadryl and that type of thing, and how dangerous that is.
Well, the kids call these Skittles parties. They'll go into the medicine cabinet, and it can be over the counters, and it's opioids, it's benzodiazepines, it's anything. I mean, it can be their dad's lisinopril. It can be, they don't even know what these pills are, but they go in and they empty all these prescription bottles and dump them into a baggie, and then they get to a party, and there's a giant bowl on the coffee table, and literally everyone dumps their pills into a bowl, and they all start drinking. And then they just take a handful of like Skittles, what they call Skittles, and they take the pills. They have no idea what they are. And part of the thrill is not knowing what they are and sitting and waiting to see what effect they might have on them.
Are these the same kids that ate the Tide Pods?
Probably so. Probably so. And it's very alarming. I mean, we can't make sense of it as adults, but these are kids who, their decision skills aren't quite there yet. But part of our responsibility as adults is to get these things out of their reach. I mean, we think about it initially that it's toddlers that are, in danger, and we think of the door locks and the cabinet locks and that once they're past 4 or 5 years old and they're not going to stick everything in their mouth, that we can throw stuff in drawers and it's okay. But then they get to be, preteens and teens, and now they're back going through drawers looking for these kinds of things. And maybe it's not even your kids. I mean, we all think our kids are good. I mean, my kids are good. They would never do something like that. But, I, for one, had a bottle of Tussianex that I knew I'd gotten for one of my kids who had cough and upper respiratory. And, of course, then it tasted nasty, and she used 1 or 2 teaspoons, and I had 4 ounces left. Well, then a month later, when the next one had bronchitis, I go to get the Tussianex out of it, which is hydrocodone, and I go, bottle's gone. It's not there. And I thought, well, maybe I hid it because I knew that, this might happen. And I looked everywhere. It was gone. In my house. I was shocked. I was shocked. So it's you never think it's you, and you don't think it's your kids. You don't know who might open drawers and cabinets looking for these things, and they walk away. So we literally do the Dispense RX packet with every opioid and tell the family, if you can't make it back here, and we've got the kiosk right across from the pharmacy, if you can't bring your prescriptions back, then please use this Dispose RX. And if you've got 1 tablet or you've got 20, you fill your vial with 2/3 of warm water, you empty the packet, and it disintegrates or, it inactivates the drug. And you put the lid back on it, shake it, and then you can throw it, you can discard the drug, and, then no one can retrieve the opioid from it. But I think the biggest message that we can send to the public, whether they're our patients or our community, our community, they are our patients, is that, we've got to take care of our kids. And, you look at some of these numbers of 12 to 17-year-olds, and the statistics are alarming, but they double and then quadruple in different categories for then 18 to 25. So when you look at the impact that they have on the kids in the age group that we treat here at Scottish Rite, and then the impact that, as they move into that next age group can quadruple. It's like you just can't take it lightly. And it's not just, the bad kids it's not a gang thing, and it's not a race thing, and it's not a socioeconomic thing, and it's not we all think that it's not us. But these are good kids and I think the biggest misnomer is because they're prescription, they think that they're safe.
Boy, some sobering reminders and great thoughts from Stacie Bukowsky, Director of Pharmacy at Scottish Rite for Children. Now, when we come back, we're going to meet a gentleman who you may know from his restaurant in Irving, or you may have seen his story on local television when he got out of the hospital after having COVID-19 in what is now still a 6-month battle. Through prayer, determination, and some excellent health care, he is still alive. That incredible story next on the Human Side of Healthcare.
Covering the healthcare topics that matter most to North Texas. This is the Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
And welcome back. We do have a story of the human side of healthcare now. A local restaurateur who got COVID back in December and nearly died. Now, we're going to tell his story.
Thomas, this is incredible. We've talked a lot about COVID-19, but we've never really talked to a patient. This individual wanted to share his story about COVID-19.
We're talking to Hugo Miranda. He owns Hugo's out on North O'Connor. You may have seen it out in Irving. Very nice upscale Mexican restaurant. Also coming to Uptown soon. Hugo, welcome to the show.
Thank you. How are you?
So when were you diagnosed with COVID-19?
I was diagnosed back on December 26th.
Do you have any idea how you may have contracted COVID-19?
No, to be honest, no. I work in a restaurant, so I'm around a lot of people. So maybe it happened in there.
Right. So once you contracted it and were diagnosed, you were at home and then you went to the hospital. Is that correct?
Yeah, it was a Saturday. I was actually at work. I started feeling really under the weather. Then we went back home. I started feeling sick. On Sunday, I went to the hospital because my oxygen was a little low. They sent me home after they fixed my oxygen. But then I went back to the hospital 2 days later because I was feeling still really bad and my oxygen was really, really low. And that's when I got admitted to the hospital on the 3rd, I think, of January, I'm sorry.
When you were in the hospital, how long were you in the hospital?
I was there in the first hospital. I was 3 months. Then I was transferred to a rehab center for another month. And then another 3 weeks to a physical therapist hospital. So it was a total of 4 months and a half.
4.5 months. That's remarkable. We're so sorry that your treatment took so long. Were you ever put on a ventilator?
Yes, I was. I was for 3 months. I was in a coma for almost a month and a half. I was completely gone. At a certain point, I was sickest person in the hospital at the Methodist in Richardson.
Well, I can just say that we're so thankful that your treatment went well. But I think this is an excellent example of how dangerous this COVID-19 virus is and how it can have such a bad impact on you. To our listeners out there, do you have any thoughts or advice that you'd like to share with them about, one, your treatment, and two, your recovery?
Well, about my treatment, it was really a lot of the effort for the doctors. I got put in a couple of doses of plasma, and I also got the actually virus injected through me. I mean, the doctors did a great job keeping me alive. You just trust the doctors. They will always do the right thing to you.
Now that you've been through this experience with COVID-19, do you have any advice to our listeners about vaccines, and should they get their vaccination for COVID-19?
Oh, I mean, definitely. That's not a no-brainer. They should get the vaccination. It's something that helps you protect you, your well-being. You never know how hard it's going to hit you. You know, we got people that have been lucky enough not to have any symptoms or to have very low level of symptoms. But we also have people like me that got the worst of the virus. So definitely the vaccination is a great solution to get over with this and to put a stop to this. So I highly recommend get vaccines because this is a serious virus and we have to respect it the way it is.
You know, that's great advice, and you're so right. Many people contract COVID-19 and they're asymptomatic, or they get sick, but it's not real sick. And then there are other people like yourself where it progresses, and unfortunately you have to go to the hospital. And in your case, you stayed for a fairly long time. You've done a great job answering my questions. I'm going to see if Thomas has some questions.
I do, and I'd like to walk all the way back to even before Christmas Day and before December of 2020. Let's go back to the fall of 2020. You said you run a restaurant in the Irving area, is that correct?
Yeah, correct.
So all through the pandemic of 2020, what was your viewpoint of COVID back then?
Well, I mean, I always thought it was a serious virus. I was always afraid about getting it. I was never taking it easy on it. I was always being really careful on how do I approach everybody or how do I surround myself about everybody. It was just, I guess I was unlucky and I got it.
So you wore a mask, you washed your hands, you tried to stay away from other people, at least as best you could.
Yeah.
All the stuff, right?
Yeah.
Did you ever have any inclination that it would hit you like this?
No, never. I never thought about it. Never.
So if
it never crossed my mind.
If you thought about like, well, if I get COVID, I'll just be sick for a little while. Is that kind of, I think we all probably feel that way, right? We hope for the best, but never that you would be taken out of your life for almost 6 months.
Yeah, correct. I never thought about that. I just thought I was going to get sick like a little bit and then go back to normal.
So now as you start to get better, you're home, and you think about going back out into life, which will be the next step, hopefully, for you. How will you perceive COVID now as we're basically saying, well, it's all, let's don't wear a mask and everybody's getting back to normal as best we can, which we want to do. But having been through what you've been through, how do you view COVID now?
I still see it the same way. I still see it as a very dangerous virus. I still see it with respect. And I still gonna keep doing my my regulations, my wearing a mask, washing my hands, keeping my distance. I'm still gonna approach it the same as it's always been.
What did they do in rehab?
In rehab, they teach me how to speak again, how to swallow, how to walk again.
You lost all of that. Is that because of being on the ventilator for that long?
Yes. Yeah, that's correct.
You literally had to learn how to eat again.
Yes.
That is incredible. I would imagine you have a completely new perspective on life now as you think about it.
Yes, I do.
What goes through your mind?
Well, first of all, I was really nervous about going back home because I used to be very dependent of everything I did. And now I'm running into need to get help. But I'm trying to be as normal as I can without getting help from anybody. But yeah, I mean, life is totally different now for me than it was before. But we have to keep fighting.
What is your path from here?
Just get stronger. Just get stronger, physically stronger. So to be able to walk by myself again. I still have trouble walking or breathing. I still ran out of air. Stuff, short breath.
This thing really ravaged your lungs, didn't it?
Yeah, it did.
Now they're using this term long COVID. Have the doctors talked to you about that, like lingering side effects from COVID that might be present for you that you have to watch out for going forward?
Not really, but I know a lot of stuff like I know I'm losing my hair. My hair is one of the things that I'm like, it's driving me crazy. That's one of the main ones that I have right now, that my hair is falling off.
You going to get back in the restaurant soon?
Yeah, I need to. I need to.
And they need
to
you.
Go back to the restaurant. Yeah.
Hugo Miranda, owner of Hugo's in Las Colinas, coming to Uptown, a story that touches your heart.
It really does. And, this show is the human side of healthcare. Well, we just experienced the human side from the patient. And I'm so thankful for the other side where the hospitals, the providers, the clinicians were able to save his life. And this story has been repeated many times over in North Texas. Thank you for being with us today as we discuss this incredible story. Join us again next week on the human side of healthcare.